I'm Giovanni A. Magallaon of BSES 3 in RM1, and today I'm going to discuss to you the study of Vicente Belisario and with his co-researchers, which is entitled The Use of the Geographic Information System as a Tool for the Schistosomiasis Surveillance in the Province of Davao del Norte, the Philippines. So the diverse group of communicable disease that prevail in areas characterized by tropical and subtropical conditions are neglected tropical diseases. These diseases affect more than 1 billion people, mostly those living in the impoverished conditions without adequate sanitations. And with respect to schistosomiasis, or the SCH, in close contact with its snail intermediate host, and in Asia, also with reservoir hosts such as the livestock and some wild animals. So, the surveillance of the SCH plays a crucial role in the formulation and implementation of the effectiveness strategies for disease control and prevention. The use of the Special Information Technologies, or the SIT, which includes geographical information systems, may serve as innovative approach in the SCH surveillance. The application of the GIS in mapping temporal and spatial distribution of the S. japonicum and assessing the rest of the infection that has been demonstrated in China. So, the objective of this study is to demonstrate the utility of the geographical information system as a tool for the SCH surveillance in the province of Davao del Norte. So, we have here the materials and the methods. So, the study was conducted in the Davao del Norte, a province in Region 11, which is the Davao region of the Philippines, and it is bordered by Agusan del Sur in the north, the Davao Gulf, the Davao City, and Compostela Valley, also in the Davao del Sur in the west. So it composed of 8 municipalities and 3 component cities, namely the Asuncion, the Braulio, Dujali, Carmen, Capalong, New Corelia, and Santo Tomas, and one city, which is the Tagum City, are known as the SCH endemic. Davao del Norte has a total population of 945,764, and that was according to Philippine Statistics Authority 2013. So the data collection and processing. In order to get this data, the SCH determinants and variables were identified through review of the literature, the discussions facilitated by the WOW project team, and participated by key staff of the DOH Regional Office 11 and Davao del Norte Provincial Health Office to identify the data sources that was collected. The latest qualitative and quantitative data on CH determinants were requested and obtained from the local government offices, agencies, and partner institutions. The municipalities were classified based on the presence of the favorable SCH transmission. So we have here the determinants, the variables, and ecological conditions supporting the schistosomiasis determinant, such as the geography and the climate, and the variable is the topography and the temperature. The agriculture, the determinant, agriculture. The variable is the irrigation, that is from the Pagro and NIA 2014, and the poverty, and the variable is the poverty index from the PSWDO 2012, and sanitation intermediate and snail host. So from the geography and the climate, I don't know. So we also have the animal reservoir host. The variable is the presence of the reservoir host. The SCH variable is the prevalence level, and the treatment, which is. So the results. Del Norte has mountainous areas in the western part, municipalities of Talaingod, San Isidro, and wide plains of the lowland areas. All major river pass through the barangays known as CH municipalities. Municipalities not known to be CH, on the other hand, are mostly mountainous and have barangays that not adjacent to major waterways. An exemption is Panabo City. So this is an example of a GIS. The map, the figure 2 showing the topography, that is the municipal and the barangay boundaries, major roads and highways, terrain, major rivers and creek, as well as flood prone areas in Davao del Norte. And then the second figure showing the topography of Davao del Norte overlaid with the temperature data. So figure 4, which shows the land use in Davao del Norte overlaid in topography and temperature data. The second or the fifth, the figure 5 is the poverty level, the sanitation of Davao del Norte together with the topography and temperature data. So figure 8, a mass drug administration in Davao del Norte overlaid with topography, temperature, sanitation, and distribution of the snail colonies data. So they say figure 9, the map of Davao del Norte overlaid with the schistomaeuses and the determinants and the variables. So the relationship with determinants and variables, humans contract with the SCH through exposure to Schistosoma cercaria in infested bodies of fresh water with colonies of snail intermediators offend nearby. Development of S. japonicum will not proceed without colonies of O. hopensis quadrasi in the vicinity. The temperature is an important determinant both for the snail and development of the parasite in its host. Studies have shown that S. japonicum only develops in O. hopensis at temperatures higher than 15.4 degrees Celsius, fastest development occurring at 30 degrees Celsius. And the land elevation may also affect the SCH transmission such that low-lying areas near bodies of fresh water may provide potential habitats for the snail intermediate. The flooding has been reported to increase the area of potential snail habitats fivefold and may put more at risk exposure to water infested. So geographical information system, the schistosomiasis prevention and control, given that data on the SCH determinants are called by different local government offices, partner agencies, and institutions, mapping of the presence and distribution determinants through GIS may be useful in providing better analysis, leading to facilitating policy formulation and strategic planning. The use of GIS allows the demonstration of conditions favoring transmissions and the interplay of these determinants. Correctly applied, GIS contributes to evaluation of control programs and reviews since data visualization in space, and possibly also they may be improved data utility. So in a short, but nag-exceed na ko sa time. Thank you so much for listening and God bless.